Well, hello, everyone. This is Brian Prokop. He is a PTA of 28 years um, and is a member of APTA, and he works for Adventist Medical Center. And I'm going to be interviewing him with a few questions. He's been kind enough to take the time to chat with us today. Welcome, Brian. And I'm Anne Marie Hallweiler. I'm a student PTA. This is my second term in Lane Community College's PTA program. So I'm excited.
Thank you for the invitation.
Yes, thank you. So this is an outpatient orthopedic clinic that you work for?
Correct.
Okay. And how did this come about? Often PTA is a second career choice for people. Was this your first or was it a second? And why did you choose it if it was straight out of high school?
Yeah, so for me, it was straight out of school. I guess a little bit of it goes back to, there's probably it's a twofold reason, but I'd say like when I was in maybe 7th grade or so, my grandmother on my dad's side, it was like a Christmas Eve, she fell, she fractured her hip. She had a hip pinning surgery, and then unfortunately, kind of some complications that resulted after that. But she ended up going to a skilled nursing facility for a little bit, and then ended up actually kind of living part-time with my family, and then her other daughter, my aunt, who lives maybe about half an hour from we do. And so we kind of went back and forth as far as providing care and stuff for her. And the interesting thing, I mean, nobody in my family had any background in the medical field or healthcare or anything. So we were kind of just navigating this, for the first time. And, in healthcare, I guess, in the mid 1980s was a little bit different than what it looks like today. And so she did get, some PT when she was inpatient in the hospital, and a little bit at the SNF and some home health there. But I mean, none of it wasn't really extensive back then, at least that I could recall. And, I don't know why that was. It might have just been, that particular era. But so as family members, we pretty much were kind of tasked with, helping to get her back up on her feet again, helping her to transfer, to walk. We used this, I remember we had this like small wooden apple box that my dad had that she would use as a step to get up into his pickup truck. It wasn't a big truck. I mean, it wasn't lifted or anything like you see driving around nowadays, but, so we kind of had to be, problem solving, solution oriented, in figuring out ways, how to help her and, to kind of get her functional again. And I guess, that's kind of maybe where physical therapy appealed to me, kind of more that hands-on approach and being able to help in her case, as best we could. And I'm sure, in that process, we didn't do everything right. We probably made some mistakes and along the way, but, we did the best that we could. And I think kind of out of that, stemmed, at least for me, I was always kind of thinking as I'm watching, my folks and my aunt and uncle and helping, with caring for my grandmother and getting her up and ambulatory again. I just remember kind of thinking I'd see certain things. I'm like, it's got to be maybe a better way to do this, but I wasn't exactly sure what that way was. And then it did happen that my mom knew somebody who worked in physical therapy. And so it kind of got me to thinking a little bit about that particular field. And as a kid in school, science was always kind of like my thing, but I didn't like needles and I didn't like blood. So I thought, okay, being a nurse or whatever, yeah, that's not something I'm interested in. But I actually ended up volunteering at a medical center about a half an hour from where I live when I was finishing up high school. And I'd spend like 1-2 mornings a week there and just helping out, whether it was, filling out ultrasound gel bottles, cleaning out the hydrocollator, because they did some wound care and other things there. And I also had the opportunity to go with one of the therapists up on the floor. And I just remember them working with stroke patients and just kind of the whole involvement of everything, it really, I felt like it was giving, some of these people hope who were in situations that, maybe they felt a little overwhelmed by their situation, a lot like we kind of felt when, we were having to care for my grandmother. You have all of these kind of unanswered questions, you have certain anxieties, and you're trying to make sense of it all. And maybe as a kid, it's just a little more overwhelming, but at least through some of the experience I had with PT there, and the therapist or the assistants came in, and they were able to kind of take a situation that might have felt maybe a little overwhelming for the patient or family, and kind of help put things in perspective a little bit, answer questions, not that they had the solution to everything, but kind of help allay some of those anxieties that I think a lot of us, would experience if we were in that situation.
Right. So in this volunteering, you were still in high school at this point, is that correct?
And actually just right after. So I ended up
Right after, okay.
a year afterwards. Yeah.
Okay.
And then that gave me a chance to kind of check out,
Right.
a few things and really kind of decide if that was what I wanted to do. But
Right.
kind of like I mentioned, I think, some of the hands-on part of it, problem solving, looking for solutions, that part of it um, appealed to me and intrigued me. And I thought, hey, maybe I can, actually, be of assistance to others that way.
Right. Absolutely. Because who doesn't have a health problem these days? There's a problem, we have solutions, and that's what I love about it. I want to get behind that why, like you do too, and the figuring out part.
Yeah, certainly.
Okay, so then at that point, you're volunteering and you make a decision to go into college. And you started out with the PTA school. Okay.
Yeah, and it's school was a little bit different back then than I'm sure as it is now. When I started, you didn't have to have all your prerequisites in order to get into the program. So I was fortunate I was able to get in, and I think because of my grades from high school, and it was just, fairly shortly removed from that. It was a pretty easy transition for me. But I was taking all those prerequisites at the same time I was in the program, where I think pretty much I was maybe the only one in the class doing that. Everybody else had all the prerequisites, or some of them, this was a career change for them. And yeah, so that was a little bit different, but it worked out well. I remember just kind of my first day of class sitting, in my anatomy physiology class, and then in the intro to PT. And I just remember thinking, man, this feels right. This is like where I really am comfortable and want to be. And so it just kind of took off from there.
Uh-huh. Wow. That's pretty amazing. You seem like you were pretty mature and intuitive coming, right out of high school, like that. I know for myself, I waited on college until just 7 years ago. So I was 38 at the time. But through that time, I can't count how many times I've changed my mind over, well, what do I want to do? What are my interests? All those kinds of things. So that is terrific. How does the PTA team benefit patient care?
And, in a lot of ways, it's really a collaboration. I mean, it's a teamwork between the two of us there. And really, ultimately, the goal is to offer, excellent continuity of patient care. And it allows really kind of in a lot of ways, like for me to handle kind of maybe some of the more routine things with patient care, post-op patients, being able to progress them. And then it does free up the PT to handle maybe things that are more complex. But I also think too, just really layering the PTA relationship there, it really provides like a second set of eyes, if you will, in treating the patient. My job, our job isn't to, compete with the PT. It's not to take their place, it's to complement them. And so many times over the years, the PTs that I've worked with, we may share, similar skill sets, but we also have different skills and areas of interest and expertise. And I think that can really help us in providing, comprehensive and whole person care. And, on a really, for me, kind of in our healthcare system that I work in on, at any given time on a daily basis, I'm working with, and seeing patients from several different therapists. And in that process, and my boss and I would kind of talk about this a lot, our role as PT assistants is not to be, a technician. I'm expected to, and I want to, utilize critical thinking skills when it comes to the care that I provide. And part of that's, progressing the patient through the plan of care that's been outlined by the therapist, but, making adjustments when necessary, and then, constantly assessing, if you want, the patient's response to treatment and interventions that we're using, or, I'm always, asking myself, okay, what's the rationale I'm using for this particular part of the treatment, or why am I doing this exercise versus another exercise? And so that's something that I think, we're always, at least for me, I'm always kind of looking at and assessing in my own mind, and trying to get that patient from where they're at presently to whatever their ultimate goal is, and where they need to be. And then, at the same time, I would say that, being able to just report to the PT on that patient's progress at, any given time. And, this is where they're at in the progression of our, therapy, and this is how they're doing towards meeting goals. And these are concerns that I see. And the nice thing is, we're all working together there in our clinic location. So, at any time, I mean, I can ask them a question, or we can talk about it at lunchtime and problem solve. And so I have just found that, over the years, I've had the opportunity to work with some really amazing clinicians, ones who are, had special certification, OCS, GCS, certified in McKenzie, but, whatever their specialty was, I mean, they were, really gracious and willing to share their knowledge. And then I would, tailor my continuing education to kind of the therapist that I'm working with to a certain degree. But then I'm kind of interested in a lot of things. So anytime I can pick up and learn something new, or a new technique, or a new exercise, or a new way of approaching something, I hope I'm more of like a sponge. I'm there to absorb that. And that's really one of the things that, I've always tried to do over these years. And then as you work with different therapists, you build that relationship of trust with them. And I get to know, and kind of a little window into their clinical reasoning and some of the decision making they make, and then they in turn get that from me. But it's constantly always learning, and at the end of the day, it's trying to do what's best for, the patient, and hopefully, get them better.
Yeah, it sounds like it's such a good system that we are providing through collaboration for the wholeness of the patient, and through the healthcare, and the just kind of the layering and the feathering effect to provide that compassionate, exceptional care that our healthcare system so desperately needs right now.
Yeah, and I also think that, considering the education of therapists nowadays, they have, their doctorate, and so, as someone who's supporting or assisting them, I always kind of think of myself, okay, well, if I had my DPT and the person who's working under me, would I just want someone, I just pull this person off the street, and yeah, we got them a little training, and they're here to kind of follow up behind me? I mean, I'd be like, well, no, my license is on the line here. I mean, this is, my profession. And so I think, the more skilled that we are as assistants, just really helps to support them, and it just, moving profession forward is, where I think some of that comes into play there. And so it's great to be a part of that.
Right, absolutely. Is there a lot of places to where you can kind of soak up that extra experience and kind of learn some of those extra things when you're out, you know, in the job world as a PTA?
Definitely. I would say that, you know, there's so much variety when it comes to continuing education out there, and just being able to, you know, avail yourself of that. You know, it's really outstanding. And honestly, when I look at the opportunities for CE today, you know, I've had classes from, you know, some of these therapists that are, you know, leading researchers, and, you know, they work with professional athletes and, you know, the geriatric population or whatever. But one of the amazing things is they're just so willing to share information. I mean, that, I mean, I see their names, you know, connected to the research, and then all of a sudden, you know, you're in class listening to this particular, you know, presenter, and it's like, wow, I mean, this is impressive, and be able to sit there and take that in and know that they're accessible as well is really quite remarkable. I mean, so many times I'll be like, well, hey, you know, here's my email. So if you know, if you have a question or you want that research article, or yeah, shoot me an email. Or if you have a question about a patient, you know, you can feel free to, you know, get in touch with me. And that's just a remarkable thing, because you know, we probably all have friends, we send them a text and they don't respond for, you know, a week before they get back to us. And I'm thinking, you know, these are people that are really kind of leading the way in the profession, and yet they're willing to get back to us. And it just really goes to show they love the work that they're doing, and they're happy to, you know, share that information with us, and to be able to avail ourselves of it and get better is really a pretty special thing.
That's phenomenal. What are the, let's see, what has been your most rewarding experience as a PTA? That would be hard for me to answer.
Yeah, I guess there's, if you're looking for like specific examples, I remember when I like first started out working, like the first 5 years of my, you know, working in the profession, I was in a skilled nursing facility. But I just remember having a patient, he had a stroke, and he had been in, and I was seeing him for like, you know, he had it was like the second or third visit, and he had seen a professor of neurology at health sciences university. And so when I went in to see the patient that day, I just remember he was very distraught, and he said, well, he said, they told me I'll never walk again. And, you know, in my youthful exuberance, I didn't say, oh, well, we'll get you walking again. I mean, I wasn't, you know, that foolish. But I just remember, you know, I said to him, I said, well, you know, I said, the one thing that, you know, we have all these tests and all this other stuff. I said, you know, the one thing they can't measure is what's in here, what's in your heart, and you know, that desire. I didn't know what else to say, but I'm thinking, you know, I said, well, you know, that's one thing how do you measure that? And I said, I'll tell you what, I said, I love what I do. And I said, I will come in every day with hopefully the enthusiasm and the energy to apply, you know, everything that I've learned, you know, as a newbie just out of school. And I said, if you're willing to work, I said, we'll just see where this goes. I mean, who knows? And so he's like, sounds good to me. And so it was like 2 months later, he had a follow-up with this professor of neurology, and he went from being non-ambulatory to he was able to go to that appointment. He was using a Hemi walker. And he said, yeah, he said the neurologist looked kind of surprised. And I was like, well, that's exciting, you know. And then I think it was a little over a month later, then he was able to, you know, discharge to home. And, you know, I don't know whatever happened after that, but just, you know, being able to work with him and you know, start putting into practice the things that you know, you learn in school. And, you know, and I'm sure I did things that were probably a little not even, you know, textbook appropriate at the time, but you know, you did the best you can, and then you take classes and you continue to grow. And so hopefully, you know, our skill set improves and we're better able to, you know, help people, you know, along the way to the recovery. I also remember when I was a student, and it was my in the second year, and I think it was my third clinical. One of the days, I kind of split time between two locations, and it just happened that on this particular Friday, one of the patients I was scheduled to help co-treat with the PT assistant at this location was somebody I went to high school with. He had been in a pretty bad motor vehicle accident and had a head injury. And just remember walking in the room and, introducing myself and whatnot. And, his eyes kind of lit up because he remembered me. I mean, I live in a small town, and for a lot of us, that we're here, we started in, preschool or kindergarten together, and some of those same group of kids, we graduated from high school together. So, you get to know people well, or their families, and so that was kind of a unique experience as well. And just, having that opportunity to work with someone and to see him progress during the number of weeks that I was there was really an exciting thing as well. And hopefully, giving people some hope and encouragement, and in treating him, I guess, knowing, I knew his background and where he came from, he knew me, and just kind of being able to share that, kind of a little bit of a special bond there was a neat thing.
And I bet it made it, just kind of having known you previously, gave him a little bit more comfort and familiarity too. How exciting to be able to watch all this evolve and unfold right in front of you. It sounds very rewarding.
Most definitely.
What are some of the biggest changes that you have seen in your work since becoming a PTA 29 years ago? I'm sure a lot.
Yes, most definitely. Thinking about it, I would say in part reimbursement of PT services. I don't think comes as any surprise that there's, a limited number of, amount of financial resources to go around. And so just the importance of being able to justify, what we do and the services that we provide is important, and to be, as effective as we can with our treatments and educating patients. I mean, in a lot of ways, I feel like I'm kind of an educator as well. That's just kind of like the sub role of what we do, and in helping, people to kind of make sense out of, some of the complexities of things nowadays. But as we move forward in the future, probably the role of like evidence-based medicine, I mean, that's playing a bigger part in what we do nowadays as opposed to maybe years ago. And then tracking of PT outcomes and the payment or reimbursement of our services based upon those outcomes. So having limited visits and then trying to be able to, get the best possible outcomes for our patient in that minimal number of visits, and just using those healthcare dollars, as a steward really wisely. That's going to be an important thing. I do think that's kind of where being a member of the professional association, the APTA and our state chapter as well, just the ease of being able to access research and information today compared to like when I started. Back then it was like, what was before the internet era. So yeah, that kind of gets our age there. But just looking back, if there was a particular research article or I wanted information on something, the nice thing about working for a hospital-based system is I could, call over or send a request to the medical library there, and depending on what journals they had available, they could look up, if I wanted something specific, I could give them the topic, and then they would kind of sort through and see if they could find, something on that topic for me there. And then they inter-office mail it to where I'm at. But, we've come from that nowadays where it's basically with, a keystroke or two on your electronic device, you can pull up, the latest research or go to the PTA homepage there and navigate through, and you can get the latest on, research and things that are related to, other particular topics that might be of interest, and things that are pertinent to the practice of, our profession and issues that we're facing currently or moving forward. And so, yeah, I definitely credit the program director of, our PTA program at Mount Hood. When I started there, she was really instrumental in encouraging people to become a member. And there's a lot of different ways that, you can be active, from just, paying your dues or whatever, to ones who are involved in maybe different committees. And I've had coworkers who've been, intimately involved in those things. And so they're able to pass that information on to us as well. So we really get the benefit of that. Whereas if I wasn't a part of the professional association, I think just trying to, stay on top of things and to access the stuff that I felt would be, pertinent, it would be a lot harder to do. And so it's just another way to try to stay as current as possible.
And from what I understand, you are the longest standing PTA with continuous membership with APTA. Is that correct?
That's what they tell me. I guess there's a.
That's pretty amazing. What an honor.
And I've also been told that there's a PT, her name's Barbara Fallon. She's been a member for 78 years.
Wow.
So yeah, I guess I'll have to practice till I'm like 100 to catch up with her. So that's like one of those records that will never be broken, because I don't think I'll be living that long. Even if I do, I'm hopefully, I don't know, fly fishing somewhere. If hopefully I'm still ambulatory to do that.
Well, what a role model though for you and her to, to show as PTAs coming, behind you. And those are pretty large footsteps to follow in. I do have one more question, and that is, what advice would you give to newly grads of the PTA program?
Well, boy, I'd say probably, if anything, this last year, 2020 with COVID, probably, taught us to be adaptable, for one thing. And for me, like over the years, I've always been just kind of willing to adjust, learn new skills. I mean, I started out 5 years working for the hospital system in a SNF. And then I spent, because of changes in Medicare and reimbursement and whatnot, ended up moving to inpatient at the hospital, working in ICU a little bit, doing some wound care back in the day, and a little home health before I transitioned to outpatient ortho. So just kind of always being able to adapt, learn new skills, try to take in as much information as you can, learn from the people that I work with. Honestly, there are therapists at the hospital where I work that have been there for, 30, 40 years. So there's a lot of longevity and experience there. And to be able to have those individuals as resources is truly invaluable. And I would say too, the nice thing about this profession is, whether you're just coming out of school and you've got your DPT, or someone's been practicing for 30 years or whatever, you're never going to know it all. There's always more to learn, more to know. Technology is changing. And this is just my own thought, but I'm like, well, as technology changes, I'm sure that the way surgeries are done and the tools used, that changes. And so the surgical approaches are going to change a little bit. And so then there's, new ways, or we have to kind of look at, how do you, based on those changes there, does that change the way patients are, rehabilitated? So we're always changing gears and kind of, forward looking as far as what needs to be accomplished. And that's going to change the face of physical therapy. And we just have to kind of, continue to, be enthusiastic about that and go with it. And I would like to think that, after 28 years, I still tell people I think I come to work with the same enthusiasm that I did when my first day, except I'm hopefully a little bit better at what I do now than on my first day, you know, but there's still a lot to learn and know. And so moving forward, you know, looking forward to that. And I also taking students, because when I have students, I mean, I don't know what it is, but I can so vividly remember back to, like, you know, my first clinical experience and some of those things. I mean, I can't remember yesterday, but I can remember what happened 29 years ago. So I don't know what that means, but no, just, you know, being aside, I mean, those experiences are still really vivid and in my memory. And so hopefully I can pass on things then to students that I have that are working with me. And I learn from them, because they're getting inundated, as I'm sure you well know, with, you know, tons of information on a weekly basis at school. And so it's really that interchange of information that we have. That's something that I also really appreciate there.
Well, that's wonderful. That's such great advice. So encouraging. And just so our viewers know, in your 28 years, you have had one sick day and you have lots of PTO built up. So this is a very dedicated PTA. And I just want to thank you from the bottom of my heart for the way that you are paving for us in the physical therapy world, but as students as we entered into it, as well as through APTA, and for your heart and your compassion and the role model that you are. And thank you for taking the time to speak with me today.
Well, thank you for the opportunity, and a lot of thanks really goes out to all the people that I've worked with over the years, because I've gained so much knowledge from them and have benefited in so many ways through my coworkers and colleagues over the years. That's really been instrumental for me, and so hopefully I can share a little bit that'll help somebody else along the way as well.
Well, it's greatly appreciated. Thank you so much, Brian.
You're welcome.